Great Lakes Eye Care started in 1987, but in reality it started several years before that. In the 1950s, Dr. Cawthorn was an eye, ear, nose, and throat surgeon. He turned his practice over in about 1960 to Dr. J.J. O'Toole, who was an ophthalmologist, and to an ear, nose, and throat subspecialist, Dr. Burt Smith. In time, Dr. J.J. O'Toole practiced by himself, and then I started in 1987. Initially when I started, I told my nurse I wanted to go into ophthalmology because I could have a mom and pop shop. The goal was that I could see a few patients, learn the whole family from little kids up to grandparents, and go home at night. It didn't turn out that way. It turned out that I became swamped with patients, much to my surprise. Dr. Tolsma was an optometry student who grew up in the area in Baroda, and he wanted to come back home. It turned out to be a wonderful gift from my perspective because he wanted to do the non-surgical things and I wanted to do more of the surgical things. We were so busy at the time, we had 3 or 4 employees, and we were pulling our hair out just to get home at night. About a year or 2 later, Dr. McKee joined us, and the 3 of us became a team. In 1992, we moved to the current facility in St. Joseph. Dr. Brown joined us, and Dr. Brown had a really strong interest in missions overseas.
He said, man, we were going to have to spend some time with him.
He ended up and went over to Kenya, and about the same time that worked out, Dr. Pletcher joined us. We were on call for the Niles Hospital, and we spent so much time dealing with the Niles population, and it was hard for the patients there to come all the way up here, so we ended up and opened up an office down in Niles as well. During this time of growth, Dr. Marone joined us. He does an excellent job working with our contact lens patients. Dr. Vredevoogd rejoined us after doing a fellowship in Canada. She has a subspecialty in pediatric ophthalmology and is the only one with this subspecialty that we're aware of between Grand Rapids, Indianapolis, and Ann Arbor. We've also been blessed with Dr. Seward, who plans on becoming a career missionary and is a skilled surgeon in the area of corneal transplantation. When I first started, I had no idea that it might grow to the way it has. Initially we had 3 employees, and now we have in the range of 100 employees. Around the beginning of 2006, Dr. Fensky notified us that he was planning to retire, and he asked us if we'd be interested in going up to South Haven to see patients there in his office. About the time we were considering this option, we had another ophthalmologist that joined us, Dr. Wong, and it turned out to be a very good fit for Andy to help see patients in South Haven. So currently we have 3 offices. We have an office in South Haven, our main office is in St. Joseph, and then another significant office is in Niles. One of my patients tells a story that one thing she liked about our old office was there was no room for her, and so we told her that she could just wait out in her car, and when it was time, we'd come out and get her. We did this more than once. She liked it because she got to stay out there with her father and talk to him.